Healthcare Ready was founded in the wake of Hurricane Katrina as a response to some of the lessons learned during that crisis, where essentially members of the healthcare supply chain, the public health organizations, and emergency management agencies that respond to crises like these realized that more coordination was needed to ensure that the healthcare system could be more resilient against disasters, as they are, increasing in frequency, of course, and severity, and now more so a normal part of our day-to-day lives is the risk of healthcare crises. And so Healthcare Ready was founded to be a trusted information sharing center and a partnership between the healthcare supply chain organizations across the board, from manufacturers to distributors to pharmacists and the end mile, as well as connecting with the public health agencies, the public health organizations, and the emergency management agencies that respond during disasters and need to coordinate and communicate with each other. And so it was a response to the industry recognizing the challenges that exist there. And so we exist to essentially make their jobs a little bit easier, and find ways to share information better, partner better, and communicate better. So of course, right now, as we are in a time of crisis dealing with the COVID-19 pandemic response, our job is just as important as it ever has been. And so we are working around the clock and creating a lot of resources and a lot of information, sharing information across the board. And so essentially, this involves supporting the integrity of the supply chain, finding potential risk, acting upon those, and providing strategic input to the private sector that is able to respond to the call, and then providing that information to the public sector that is coordinating the response across the board. We have partnerships with healthcare systems to identify the needs and the challenges, identifying critical lists of medications and supplies that are needed to treat COVID patients, as well as the potential shortages and disruptions that may exist for patients with other healthcare needs at this time. This, of course, has included global response, as this is not just a nationwide event, but is a pandemic, and many countries are impacted by this, and many countries that we work with closely to provide inputs to our supply chain are being impacted. And so it's really about identifying those risks as well, tracking that information, and determining how to best support the NGO and global response efforts, because this response is not just about protecting the US healthcare system, it's about really responding to the global needs that exist. And I want to make a direct point about the support to communities and patients that is, of course, critical now, where there are patients with overlapping needs as we look at the healthcare response and look at the information that is needed for people to stay safe right now at a challenging time, not for just for the healthcare system, but for the people living day-to-day lives and trying to stay safe and trying to navigate their own healthcare needs.